Well, we're here bright and early every morning. Well, early at least, to bring you the news. But plenty of Australians find themselves awake at night for no good reason at all. Researchers are preparing to test a new drug that could tackle insomnia. To tell us more, Professor Shantha Rajaratnam from Monash University joins us now in the studio. Very good morning to you.
Great to be here.
Subject very close to our hearts here. So tell us about the research and what it could mean for people suffering from insomnia.
So insomnia is the most prevalent sleep disorder. It's highly prevalent in the Australian population and also all over the world. We think that the estimate is about somewhere between 10 and 15% of the population probably have some level of insomnia.
Wow.
Now, this is a huge number, but we also know, and the classic symptoms are that people have difficulty falling asleep, difficulty staying asleep, and then waking up much earlier than they would like to. And this affects all manner of aspects of their health, particularly their mental health, but also their productivity, their risk of motor vehicle accidents, workplace injuries, and so on. So what we really urgently need is new treatment approaches that clinicians can use to be able to manage this very complex condition and this highly prevalent condition in the population.
And what's the treatment approach you're looking at in particular?
So in this particular case, a new trial is being launched of a drug that is called cannabidiol, and it is one of the ingredients of the cannabis plant. It has been reported in other trials to have benefits in the treatment of anxiety and pain and other conditions. But what we're really desperately in need of is a good evidence base to be able to determine whether or not it can improve insomnia. And so a large-scale pharmaceutical trial is really required in order for experts to be able to, know in a convincing way whether or not this treatment is going to show promise for insomnia.
So how does this treatment differ to what else is available to treat insomnia in people?
So there are multiple treatments for insomnia. Some of the treatments rely on psychological treatments, so cognitive behavioural therapy for insomnia, and that is appropriate in many cases. In other cases, we have pharmacological treatments, and they all affect different mechanisms, different ways in which we're trying to improve the sleep signal. This is a new mechanism targeting a different mode of action. And the reason that's important in insomnia is because even though it's called one disorder, there's actually multiple causes of insomnia. And so it's important for clinicians to be able to have different treatment approaches that suit the individual patient.
How is this pill with, as you say, cannabis properties different to your average Heinz variety sleeping pill that a lot of people take to deal with insomnia?
Well, that's what the trial needs to show. The trial needs to show whether it's going to be effective, whether it's going to have particular subtypes of the population that benefit more, that how long it takes for the efficacy to show, and so on, so that you can compare it with other existing treatments for insomnia.
So you said 10 to 15% of the Australian population suffers insomnia. So I'm guessing you wouldn't be struggling too hard to find people to participate in this trial. But how does this trial work? How long do people need to take part in it for you to see that there's evidence that it either does or doesn't work?
So the trial is looking for people over the age of 18 who are experiencing insomnia, have access to a smartphone so they can participate actively in the trial. It's a trial that's monitored, where people are monitored in their homes, and so the protocol requires monitoring of sleep and wake and so on in people's homes, and so it's really looking at in a naturalistic setting at whether this treatment can improve their insomnia condition.
Okay, we'll certainly stay across it, and my people may just speak to your people in terms of participants in the trial. Professor Rajaratnam, thank you so much for coming in and chatting about it.
Pleasure to be here.
Thank you.